Hi, I'm Dirk van Bavel, orthopaedic surgeon from the Melbourne Hip and Knee Group. I also work with Stryker, teaching and training on MAKO robotic surgery, and today I'm going to show you how I plan a MAKO robotic knee replacement.
At the start of every case and before planning your component positioning, it's a good idea to review your CT landmarks as was seen in part 1 of this video trilogy.
When we come to looking at the implant planning part of the MAKO operation, it's important to understand how to work your way around the screen. In the MAKO planning, on the right hand side we have the components and their sizes, and it's quite easy to change this by just clicking on the plus or minus buttons next to each of the components. These row of buttons here allows you to see the arrows for moving the components, the prostheses, the bone model and cuts, as well as the CT view, the rotational landmarks, the probe pointer, and the resection landmarks. I think it's best to keep most of these on when you're planning. And the first thing I would do is look at the femoral component and try and shape match the posterior medial aspect of the femoral condyle to match the patient's natural native anatomy. So we can see here that this is the femoral condyle, and here with the purple line is the bony anatomy, and the green is the prosthesis. So this prosthesis is sticking out. It's just a couple of mils proud, both distally and posteriorly, which is probably a fraction too much. So you might tuck this in a little bit. All right, and this would allow for the normal amount of articular cartilage beyond the bone model. So I think this femoral condyle now matches the shape of the native femoral condyle, whereas this is osteophyte, but the native bone follows a curve around here. If we're not sure whether this is the right size, you can easily move up one size or two, or move down a size to see whether you think this fits better. And often it's a matter of playing around with this until you think that, you've got it right. Once I've looked at this posterior medial femoral condyle, I will then have a look at the shoulders of the prostheses and the trochlear groove. Now, in this view, we can see that the medial side of the femoral condyle is just sticking out a little bit beyond native bone, so we can edge this over 0.5 millimeter at a time to sit more naturally within the articular cartilage and within the native bone. This is now sitting a little bit deep from the trochlea in this view. Let's just work out where we are. Okay, so this is now in the center of the trochlea, and if you come back to this view here, we're sitting a couple of mils deep to the trochlea, which is not the worst place in the world to be. All right, we can adjust this if we want, and if you're going to adjust the femoral rotation, it's worthwhile lining up this little red arrow with a peg on the femoral component. And that allows you to rotate the femoral component while keeping the same proximal, so the same distal and posterior margins to your prostheses. And you can see as we flex this component, the trochlea actually gets closer to the native trochlea. Right, and as we extend it, and this takes the trochlea a little bit further away from the native bony trochlea. All right, so somewhere along here there is a sweet spot. All right, and we'll have a look at that and move across the far left-hand side of the screen where we see our coronal views. In the coronal views here, we want to have a look at where the anterior bone cut is exiting. All right. And I like to have a fresh bone cut all the way to the tip of the proximal flange anteriorly of this femoral component. So I would extend the component a little bit from here. And I think something around about there will be the right amount of fresh bone for the anterior flange of the femoral component to sit on. When we look at the tibial component, there are different ways of planning your tibial component. Looking at the posterior slope, some people would set all patients to 3 degrees. Some people like to follow Scott Logan's theory and put all of them at 0 degrees. Some people vary between PS and CR inserts, and some people match the normal native bony anatomy. So for matching the anatomy of the the tibial plateau on the medial side, we probably want to put a little bit more slope in here. All right, you might want to dial this up to 4 or maybe even 5 degrees tibial slope. If you're someone who likes to stick at 3 degrees, that's very reasonable as well. Looking at this transverse view of the tibia, we want to make sure the tibial component is going to fit flush within bone. Now we can see here we have osteophyte and the native bone around here. And just by scrolling up and down, we can see what fits best. All right, this is quite a nice fit. We've got just a tiny bit of overhang medially and anteromedially, but no overhang posteriorly. So if we want, we could nudge this back a fraction and maybe rotate just a fraction and see if that gives us a slightly better fit. So overall, it's a pretty good fit. And we can look at these coronal views as well and look on both the lateral and medial side to make sure there's no significant overhang of that tibial component. One of the things I do worry a little bit about my total knee planning is to ensure that the posterolateral aspect of tibial plateau doesn't hang out over the back where it might be impinging on the popliteus. Now here with all this osteophyte, that won't be a problem. But on the sagittal slice, we can look quite easily down here and look at the posterolateral aspect of that tibia and make sure it's not overhanging. And that looks quite nice.
Now it's time to watch MAKO Total Knee Planning Part 3 on alignment.